To maximize the effectiveness of your PSE work, it is important that organizational policy changes and environmental supports be made in conjunction with the PSE site activities. This helps ensure that the changes you make at the site are going to be sustainable over time. The strategy section is where you will record all the ways that SNAP-Ed funds or people have contributed to PSE efforts at this site or organization. So once you see the strategy section, you can begin by choosing any additional activities that were implemented at this site to support this PSE work. You can select any and all that apply. Under SNAP-Ed funding, you will see a list of ways that SNAP-Ed funds or people might have contributed to PSE efforts. Choose the level of involvement funds or people had in each of the activities listed. These options include lead or major role, supportive role, no role, or not applicable. You will need to provide a response for each row in order to move to the next section. You have the option of using the text box to add other ways that SNAP-Ed funds or people contributed to these PSE efforts. If youth were involved in your PSE efforts, select yes from the drop-down menu, and then include the number of youth that were actively involved during the current reporting year. Once you are done with this section, click on Save and Continue to move on to the next. Adopted section documents the changes adopted at the PSE site or organization. This includes the undertaking of a new or modified policy, a change to the system or environment, that heightens the appeal of healthy food and beverages. It can also involve expanding access to or promoting physical activity, as well as reducing the amount of time spent sedentary. To add a change, click Select Changes. You will then see a window that has a very extensive list of changes. You can use the search bar at the top to search for a specific change, or the filter option to filter the list of changes by topic. When the proper change has been found, use the toggle on the left to add the change to the record. You will see a box pop up at the bottom stating that the change was added successfully. Select all of the types of PSE changes that were implemented, improved, expanded, or actively maintained during the current reporting year. When all changes have been added, click the X to exit the list of changes. You should be able to see all of the changes that you selected. If you need to remove any of them from the list, click the X under the Actions column to delete it. If changes were made that you could not find on the list, you can list them in the text box below. Next, we're going to scroll down to get to the reach fields. Start by selecting the method used to determine total reach. Choose measured if you obtained actual figures from a reliable source, such as attendance, a government source, or some other reliable source conducted by a survey or observation. Choose estimated if you had some reasonable basis or data on which to base an estimate. For example, the number of transactions per day and the store owner's estimate regarding repeat customers to estimate the unduplicated number of customers. If you select estimated or measured, you will need to select a source of data from the drop-down menu and then enter the number of people reached by the PSE work. If you select Other, describe the source in the field labeled Reach Data Source Other and also enter the number of people reached. If UTHealth is providing you with the reach estimates, you would select Estimated for method used and Other for source of data and enter UTHealth estimate. Next, choose a method used to determine characteristics of total reach from the drop-down menu and complete the fields that populate. So you will see all of these fields populate and you will need to enter numbers in each of those. For now, we will select Other under method used or unknown so that we can move forward. Once you are done, click Save and Continue to move on to the next section. The changes adopted is the last of the sections that UTHealth needs for reporting to HHSC. Remember that the red asterisk next to the heading of a field indicates that that field is required. You will not be able to save the record until you have added input into that field. The remaining sections, reflection is the only one that is not required. The next section after changes adopted is individual effectiveness. To successfully measure the effect of the changes made at this site or organization, the people who interact with the site should be evaluated. This section is where you will specify the ways you have tracked the impact of your PSE work at an individual level. You will start by indicating whether individual level effectiveness was evaluated at this site. If you did not conduct any evaluation during the current reporting year, select no. And then save and continue to move to the next section. If you did conduct evaluation, select yes, and then complete all the fields to add your individual level assessment tool, or at least those with an asterisk so that you can move on to the next section. So we'll add assessment tool, select the assessment type from the drop-down list. If you select survey, you will need to add the name of your assessment tool. You can select from the list provided or select other and add the name of your tool in the text box. Then add the approximate date the assessment was administered, and you have the option of adding a description of the results. Be sure to click on Save and not on the X in the top right to add your assessment tool to the page. Again, if you need to make any changes to your assessment tool list, you can click on the edit icon to edit the entry or on the X to remove it. Once you're done with all the fields, click on Save and Continue to move to the next section. Awards, media coverage, and other forms of public recognition can be an important indicator of the effectiveness of PSE work. Please report any awards, recognitions, or media coverage related to this site or organization. You will start by indicating whether you have received any recognition coverage for the PSE work at this site. If you did not, select no. If you did, select yes, and then complete all the fields, or at least those with an asterisk. Depending on which type you select, you will have additional fields to complete. Make sure to select the type and then complete all required fields. Again, when you have windows like this pop up, make sure to click on Save and not on the X in the top right corner. For now, we'll just click Cancel so that we can exit and move to the next section. An important aspect of PSE site activities is setting them up so that the benefits generated from them are maintained over time. The sustainability section focuses on the labor involved in sustaining and maintaining PSE work at this site for the current reporting period. You will start by indicating whether any efforts have been taken to support sustainability of the PSE changes over time. If you select no, you can then click on Save and Continue to move on to the next section. If you select yes, a list of sustainability mechanism options will display. This is a required response, so be sure to assign a response for each of the rows. All other fields in this section are optional. Depending on your responses in each of the rows, you might have more questions populate that you will need to respond. So if you select for one or more policies were adopted required the changes, if you select plan to adopt or in process, you will see another question populate. The same for support from stakeholders. Depending on your response, you may get another question to populate. Please be sure to mark a response for each of those. After completing all of these fields, you can click on Save and Continue to move on to the last module. The last section of the PSE Site Activity module is reflection. Responses in this section are intended to help you reflect on and learn from your experiences. This could be a great team activity to discuss lessons learned. You can add up to 5 assets and 5 barriers to the PSE work at the site during the current reporting year. There are also additional text boxes with other questions where you can share about your experience. This is the last section of the PSE Site Activity module. Once you are done, click on Save and Continue. Marking a PSE site activity as complete means the information reported is ready for review. You can make edits until the end of the current reporting year. If you believe you are done with entering any and all updates and will not be adding more, click on the green button, Mark as complete. Once a PSE is complete, it can no longer be edited. You will need to mark the record as incomplete if you have to make any changes. So let's click on OK, and it will send us back to complete section. If you need to make edits, you can mark as incomplete again. And then you should be able to make any changes or any updates. UTHealth and HHSC will both have access to your IA data as part of the permissions we have in PEARS. However, your data will still remain private and available only to your agency. Your individual data will not be shared across agencies, and other agencies will not be able to download your data. Only HHSC and UTHealth will have permission to export your data. As I mentioned at the beginning of this demonstration, if you have more specific questions about PEARS, please feel free to contact us and we can set up a more personalized training for your organization. Thank you for your time.